Dr. Pallavi, I have come from Bangalore. I am from C3 batch for 103 hands-on training in IVF. So I am going to talk about post-operative monitoring of the patient after ovum pickup. Immediately after ovum pickup, we need to examine the vagina in the OT theatre only and look for the puncture wounds. We have to make sure that there is no active bleeding coming from the puncture wound. If there is a bleeding, we can just put a pressure with a gauze piece and wait for a few seconds. Okay. Otherwise, if you feel that the bleeding is slightly more, we can pack the vagina and later on we can shift the patient to the post-operative ward. After shifting the patient to the post-operative ward, we have to assign one nurse to look after the patient to monitor her vitals at least every 2 hours once. And initial 3 hours, patient should be kept NPO, nil per orally, and patient should be put on antibiotics. At least 3 doses of antibiotics is required. And adequate fluid management has to be done. Again, we should make sure that patient passes urine within next 3 to 4 hours. And after 6 hours, we need to check the patient again to do the ultrasound to look for any collection inside the POD and to check again vaginally if any bleeding is there. If everything is all right, patient can be discharged home.
Can be started orally.
And can be started on orally. Analgesics. Nothing else.